The second step in designing instruction is formulating the learning outcomes. It answers the question, where are we going? Good day to you. I am Dr. Abby Jennifer Tamayo Tolentino, and for this presentation, we will focus on the second element of instructional design, the learning outcomes. When we talk about learning outcomes, we are asking ourselves as course designers, what do we want the students to demonstrate at the end? What knowledge should they gain? What concepts, topics, principles, theories, procedures, processes should they know and be able to apply? What psychomotor skills should they develop? What procedures should they be able to do? What attitudes and behaviors should they possess? How should they conduct themselves when dealing with colleagues, with patients, with classmates or groupmates, when performing procedures, or when dealing with bad news? What should the students be able to perform at the end of a teaching learning activity, at the end of a session, at the end of a rotation, or at the end of the program? I've shown this before, and again, this is the OBE Systems Framework by Spady. At the center of this framework are the culminating outcomes. And as we can see from this framework, the outcomes dictate all the elements of an instructional design. The outcomes clarifies the focus of the instruction or of the curriculum. Remember the OBE principle number one, clarity of focus. And because this is what we hope to achieve, all elements of our teaching should be dictated by the outcomes and should lead to the development and achievement of these outcomes. This is also in order to establish constructive alignment, or the alignment of all elements of ID, from the outcomes to the content to the teaching learning activities and strategies up to the assessment methods. Since we are going to be discussing about learning outcomes, of course, this presentation should have its own learning outcomes, which are differentiate outcomes according to scope and domain of learning, describe the qualities of learning outcomes, and discuss how to formulate learning outcomes. The actual formulation of learning outcomes will be part of the workshop on Wednesday. Learning outcomes can be considered as the general terminology for any type of outcome, or it can also be considered as the smallest unit of outcome in terms of scope. We call outcomes different names depending on their scope and level of implementation. The smallest is the learning outcome, which can be the session outcomes or the module outcomes, depending on how the content is structured and organized. This is considered to have the narrowest scope because it is implemented at the instructional level. Bigger in scope than the learning outcomes are the course outcomes, or the outcomes that we want the students to demonstrate at the end of a course or a subject. The learning outcomes put together should be aligned with the course outcomes and should enable the achievement of the course outcomes. Year-level outcomes, on the other hand, refer to the outcomes that we want the students to demonstrate at the end of year level 1, year level 2, and so on and so forth. Both course and year level outcomes are implemented at the curricular level. And similar to learning outcomes, the course outcomes put together should enable the achievement of the year level outcomes. Because of the learning outcomes and the course outcomes nature as intermediate outcomes or enablers, they can also be called enabling outcomes. Year level outcomes are enabling outcomes also because put together, they should promote the achievement of the program outcomes. Fortunately, program outcomes have already been decided by CHED. It has been decided by CHED for us. Now, CHED has formulated our culminating outcomes to standardize the quality of graduates that all medical schools in the Philippines produce. Institutional outcomes are considered culminating outcomes as well, and most of the time it is reflected in the institution's vision, mission, and goal. These culminating outcomes are implemented at the institutional level because this is considered the real, quote unquote, end of the instruction. To ensure that each of these outcomes will enable the achievement of the culminating outcomes, their constructive alignment is critical. This framework is from CHED Implementation Handbook for OBE and Institutional Sustainability Assessment. So we can appreciate the constructive alignment of the outcomes here, and also the alignment with the operational structures of an education system. So this is the one I'm pointing to right now is the simplified version of the OBE systems framework. And again, we can appreciate now how this should be aligned with the other outcomes or the bigger outcomes. Now, outcomes can be formulated according to the domains of learning that they target. We have three domains of learning: the cognitive, the psychomotor, and affective domains. For the cognitive domain of learning, so this is the Bloom's taxonomy, um, that reflects the six cognitive process or how a person or learner thinks. So from the lowest, it starts with remember. Remember is when an individual can retrieve relevant knowledge from long-term memory. For example, definition of terms, um, this and definition of concepts that we just need to memorize. Higher to this to remember is understand, wherein an individual constructs meaning from instructional messages. At this level, the students or the learners can already compare, differentiate, explain, or discuss. Apply is when the students or the learners can carry out or use a procedure in a given situation. For example, select the most appropriate diagnostic test to use given the complaint and results of the physical examination. Choose the most appropriate research design given the objectives of the research study. Analyze is when the individual can already break the material into constituent parts and determine how parts relate to one another and to an overall structure or purpose. For example, case analysis. Also, you will give the student or the learner a case. The student will break it down into the chief complaint, the symptoms, the result of lab test, and then put it all together to come up with a diagnosis. So that's an example of analyze. Evaluate is making judgments based on criteria. For example, critique or assess. And at the highest level is create. It's putting the elements together to form a coherent or functional whole, or to reorganize elements into a new pattern or structure. For example, formulate a treatment plan, write a research proposal, design a unit of instruction. As the cognitive process becomes more complex, it requires higher order thinking skills. For the psychomotor domain of learning, this refers to the skills which often requires manipulation or use of a tool. At the lowest is perception. So here the individual has an ability to identify and select sensory cues as guides for motor activity. So at this point, the students are still observing the teacher. Na nag-o-observe pa lang si student. If there is readiness and willingness to act already, or the student is already preparing to do the skill, then that's set. Okay. Higher to set is guided response, where there is imitation and trial and error. So here the student copies what he or she has observed. So para yang demonstration, return demonstration. At the perception level, nag-o-observe lang siya, si teacher muna. Nag-o-observe lang yung student, si teacher muna yung nag-demonstrate. Set, nagpe-prepare na si student na i-perform din yung na-observe niya. Guided response, ito yung nagre-return demo na siya. O kaya nagpa-practice pa lang siya for return demo. Nung ginagaya niya pa lang talaga kung paano ginawa dun sa demonstration. So, gayang-gaya. There is imitation and trial and error. And then, mechanism is the intermediate stage in learning a complex skill. The learned responses have become habitual and movements can be performed with some confidence and proficiency. So, habang paulit-ulit yung practice ng student sa pag-perform ng technique or sa pag-perform ng skill or pag-perform ng procedure, hindi na siya imitation na lang. No? Minsan, hindi niya na napapansin na nagagawa niya yung mga bagay-bagay kasi hindi na siya step 1 ganito, step 2 ganito. Meron ng fluidity dun sa movements niya. No? And there also becomes muscle memory already. Complex overt response, there is ability to do complex movement patterns with minimal effort already. So, mas sanay na sanay na. No? Hindi na lang habitual ang movements. Mas kaya na din niyang mag-perform ng complex movements. Adaptation, at this stage or at this level, the skills are well developed already and the learner can modify patterns to fit special requirements or respond to specific problem situations. So with adaptation, pwede hindi na step by step si learner, nagagawa niya na yung skill, minsan may na-omit siyang step na at the end, maproproduce pa din yung product na gusto, no? Or mape-perform pa din yung skills na gusto. So, that's adaptation. Origination is creating new movement patterns or new approaches to the task. No, same task, pero naisip niya na he can do the task using a different technique. He can do the procedure using a different methodology. No? So when an individual can already develop his or her own techniques, then that's origination and that's the highest level in the psychomotor domain. The affective domain of learning involves the emotional component of a learner's actions. Learning has an affective component because, as we've said in behavioral learning theories, learning has taken place if a change in behavior and the persistence of this change occurs in the students. So it starts off with receiving, or also called attending. It refers to the student's ways of indicating awareness and willingness to attend, focus, and or comply with the prescribed order of things or values held by the institutions. So at this stage, yung mga rules natin, ini-impose pa lang natin sa students or dun sa learners, o yung mga um, for example, pagsuot ng ID, pagsuot ng tamang uniform, pagsuot ng tamang damit, no? How you conduct yourself in front of the patients, yung pagpapakilala mo sa patient mo. So, at the lowest stage, no? Sa una pa lang, sa una, fino-force lang natin yung values dun sa students, no? And when the students receive that, no, that's and places attention to that, then that's receiving. Next is responding. So here there is not the student does not just comply with the school rules, the norms, or the present order of things, but there is also support and active participation in the students consistently. So, at this point, hindi mo na kailangan paalalahanan yung student na ganito yung dapat gawin, ganito yung values ng institution. This is how to conduct yourself in front of the patients. You don't need to remind them anymore. No, with responding. Valuing stage, the students behave exactly as expected. There is consistency in what they openly say as statements of beliefs and feelings. And they show and express not just pleasure but also satisfaction in their acts. Now, at this stage, there is public affirmation of their stance or positions on certain issues, and they are ready to be identified with such. Organization, there is the student ascertains the strength of their conviction to the attitudes and beliefs that they value. At this stage, there is a strong sense of internalization of range values. And then at the highest level, this is where the individual choose to pursue a life-changing path just to be consistent with the attitude and values learned. um I personally think, no, that even professionals hardly reach this stage. No? The same with the highest level in the psychomotor domain. Now, for the qualities of learning outcomes, we have the following. So, the learning outcomes should be clear. Right? It should state the desired performance and under which condition the performance needs to be done. Learning outcomes should also be relevant. It should contribute to the achievement of the higher level outcomes. It should also be attainable. Learning outcomes should be realistic, and it can be achieved within and through the planned learning experience or activity. Learning outcomes should also be adequate, which means that they encompass all the essential knowledge, skills, and attitudes that the desired learning necessitates. And learning outcomes should also be measurable. Measurable means the standards and criteria that will be used to determine whether the outcomes have been achieved or not are defined. So, CRAM, learning outcomes should be clear, relevant, attainable, adequate, and measurable. Other qualities of learning outcomes include it should be derived from the KSA or knowledge, skills, attitudes defined in professional responsibilities so that it is aligned with the bigger outcomes. It should start with an action verb so that it is observable. One action verb should be used at a time so that the outcomes are not vague. condition and the minimum acceptable level of or degree of performance should be stated in learning outcomes, and they should aim for or target for higher level abilities. And lastly, learning outcomes should be written from the perspective of the learner. Gone are the days when we do not disclose how the students will be assessed. Now, everything must be transparent. The students should know what is expected of them and how will they be assessed. How do we formulate learning outcomes? So this is a simple formula to help us in formulating our learning outcomes. So first element is time frame. No, because outcome should be attainable, time frame has to be set. For example, at the end of the, and then insert the time reference. It could be at the end of the session, at the end of a 3-day workshop, at the end of a module, at the end of the course. So that's time frame. The second element is the condition, referring to the context under which the performance of the students will be tested. For example, the students are expected to differentiate between two concepts. Specifying a condition will be asking them to differentiate these concepts using 5 to 10 sentences or giving the areas in which they should be compared. Performance, the third element, should be indicated by an action verb so that it will be observable and measurable. Again, it is recommended to avoid using verbs that are vague, and we only use action verbs one at a time. So it will go something like this. The learner should be able to, and then start with an action verb to describe the behavior. Then the last element is the criterion, referring to the standards or the minimum acceptable level or degree of performance. It can be in terms of accuracy, quality, quantity, or time. Let's take this outcome as an example. Manage clinical conditions of all patients. Looking at it, this is considered as a good outcome already. But let's try to make it better. Okay? So, again, this is the formula that we can use in formulating learning outcomes, starting off with the time frame. Let's say at the end of the clinical rotation. After the time frame condition, we state the condition. Condition again refers to the context under which the performance of the students will be tested. For example, given 20 cases. So that could be a condition. Next, we state the performance or the behavior to be demonstrated. And again, it should be indicated by an action verb. So for example, the clinician should be able to manage. That's the action verb, clinical conditions. That is the behavior that we want to observe. So that's performance. And then criterion. Criterion again refers to the standards or the minimum acceptable level or degree of performance. It could be in terms of quality, accuracy, time, or it can also be in terms of quantity. So for example, all patients in various settings. So put them all together, we will have the following outcome. At the end of the clinical rotation, the clinician should be able to manage the clinical conditions of all given 20 cases in various settings. Is this outcome clear? Is the desired performance mentioned? Yes. Is the condition under which the performance needs to be done clear? Yes. Is it relevant? Relevant. Does it contribute to the achievement of the higher level outcomes? Yes. No. Um, it contributes to program outcome number one, demonstrate clinical competency. Is this outcome attainable? Is this realistic? Can it be achieved within and through the planned learning experience or activity? I think so. Because 20 cases in a clinical rotation, I think that's achievable. Please correct me if I'm wrong. Is this adequate? Does it encompass all the essential knowledge, skills, and attitudes the desired learning necessitates? Yes. Is it measurable? Does it define the standards and criteria that will be used to determine whether the outcomes have been achieved or not? Yes. No, all given 20 cases in various settings. So let's check further. Is it derived from the KSA defined in the professional responsibilities? Yes, di ba? Clinician, clinical competency. Does it start with an action verb? May action verb? Yes. Is action verb used one at a time? Yes. No, we only have one, manage. Is the condition specified? Yes. Is the minimum acceptable level or degree of performance defined? Yes, yes, yes. So this overall is a quality learning outcome. So for our individual workshop on Wednesday, this is after the brainstorming activity. So, we will have to formulate course outcomes that target higher order thinking skills. So we will do this for the courses assigned to us. So please bring your devices, bring your laptops with you so that we can participate in the workshop. In summary, we differentiate the outcomes according to scope and according to the three domains of learning. We also describe the qualities of a learning outcomes: clear, relevant, attainable, adequate, and measurable. And that's the end of my presentation. Thank you, and I'll see you on Wednesday.